We're going to start with a few functions of the integumentary system. First, it acts as a mechanical barrier. It protects internal structures and organs. It regulates the body temperature, participates in immune response, and performs an excretory function, and it's used for sensory.
Okay, wounds, they occur from burns, sitting in long positions for long periods of time. That includes decubitus ulcers. The blood vessels are compressed and then cuts off. Cuts off the circulation, and then wound. You have punctures from needles, lacerations from cuts, and hematomas from being hit.
Ways to prevent infection include washing your hands at least 15 seconds. You can sing the happy birthday song. You can wash your hands before and after patient care and before donning gloves. Also assist your patient in turning every 2 hours. You can turn them side to side, however what's comfortable for them. The most important thing is to turn your patient. Also, encourage your patient to take deep breaths so they can have some lung expansion. You can do this by using an incentive spirometer or assisting them in how to take a deep breath and cough. Also, assess your IV sites if they're, check for if there's swelling or any inflammation at the site. Assess that every shift. Assess your patient's skin whenever, for example, you're going to give them a bath. It's a good way to inspect their skin and see if there's any skin breakdown. Keep the urinary catheter in the drainage bag below the bladder at all times. And always clean when your patient does number 1 or number 2. Clean from the urinary meatus towards the rectum. So front to back, never from back to front. Also, you can use aseptic techniques when suctioning your patient. Make sure you wear gloves and you wear a mask.
Wound healing involves an inflammatory phase which begins immediately after injury and lasts for 3 to 4 days. Has some swelling and edema, erythema, redness from increased blood supply, heat at the site, and there's pain. Second stage is proliferation stage. It begins on the 3rd to the 4th day after the injury and lasts for 2 to 3 weeks. Macrophages clear the wound of debris, stimulating fibroblasts, which synthesizes collagen, the main ingredient of scar tissue. The maturation stage is the 3rd, which begins about 3 weeks after injury. Collagen lysis and collagen synthesized by the macrophages to produce strong scar tissue. Scar tissue slowly thins and becomes paler in color.
Okay, to wash your hands, we're going to give you an example. Haley's going to sing a song for us on appropriate hand washing. Okay? Happy birthday. We can wait. Happy birthday to you. Happy birthday to you. Make sure you're down. Watch the clean hands. Happy birthday to you. Rinse. Dry your hands. Big helpful tip. Use a paper towel to turn off your faucet. Clean hands. We're going to teach you how to do some deep breathing techniques while you're in bed to promote your lungs to expand. Take a deep breath in and hold it. 1, 2, 3. Exhale out. Very into your elbow. Okay? Okay. 1, 2, 3, deep breath, and cough into your elbow. Do you feel better, like you're getting deep breaths? Yes. Good.
Areas that are prominent to bed sores or your heel, the bottom of your heel, you can put protectors on it to prevent any ulcers or breakdown. The ears, right here, like the pillow, the friction from your pillow right here, can develop wounds.
Elbows.
You can put a pillow underneath your elbow and elevate it. Also, your hip. Make sure you can assist your patient in turning and adding pillows underneath your patient to prevent breakdown. Also, your shoulders, you can put a pillow under here, and this will help from your ears and the back of the head from getting breakdown.